Mom doesn't know the dosage of the Tylenol and Motrin, but remembers she takes two 200 milligram pills, she thinks. She's also been taking 300 milligram capsule, BID of Cefdinir. She's also been taking Guaifenesin 600 meter tablet extended release. She's also been taking her albuterol 90 micrograms, the aerosol inhalation. No other significant past medical history. No sick contacts recently have been in the house. With her review of systems, she does report fever, no chills. She denies redness or drainage from her eyes. Her nose, she does report rhinitis and nasal congestion. Throat, denies difficulty swallowing, pain or discomfort. Positive for cough. It is a more of a dry cough that you would think of as an asthmatic would have. Reports daytime, nighttime dry cough for a week. Denies change in appetite, abdominal pain, vomiting, or diarrhea. Denies rash. So at this point, after assessing her as well, her pulse was 81, temp was 98.2 temporal, respirations were 18, and she's 109 pounds, and she is at the 62 percentile for weight compared to 100 other kiddos. Her physical exam showed she was afebrile, she looked well nourished, skin turgor was great, she was cooperative, she had clear conjuncti, Perla was intact, no drainage, bilateral TMs were not inflamed, bony landmarks were visible, intact light reflex, and she responds to voice. Her nares were patent, clear rhinorrhea, congestion, mucus, but no bleeding noted. Moist mucous membranes without pharyngeal erythema or intraoral lesions, moderate clear drainage in the back of her throat. Her maxillary sinus were mildly tender to palpation bilaterally. Her neck had no masses or significant adenopathy. She was supple. Respiratory, I did hear decreased adventitious sounds in the upper lobes. I did hear also expiratory wheezing bilateral in the lung fields. Normal respiratory effort. She wasn't working hard to breathe. She was sitting upright. No tachypnea, no retractions. Regular rhythm and rate for her cardio. Without murmur, normal S1, S2, no thrills. Her abdomen was soft, non-tender to palpation. Bowel sounds were all present. No rebound tenderness, no masses. Soft with hepatomegaly, not distended. No rash, elastic turgor, and she was pink and warm. Checks X-ray that we got from the ED did show patchy infiltrates, so their diagnosis was correct. So right now with our differentials, I do have atypical pneumonia. Since she has been taking the medication, she has been taking the antibiotic, she should have had no fever within 24 hours of taking an antibiotic and shown some signs and symptoms of improvement within the past 2 to 3 days, but she has not. So it could be a bacterial that is not responding to the Cefdinir. Could be a bacteria not responding to the Cefdinir, as well as it could be a viral pneumonia in which it could be also viral, in which antibiotics wouldn't improve effective. With the presentation, we leaned more towards bacterial and tried a different antibiotic instead of cephalosporin. So we diagnosed her with atypical pneumonia, mild intermittent reactive airway disease with acute exacerbation. And we also did some health education. Since she was wheezing on presentation, we gave her an albuterol nebulizer in office and came back and listened to her, and she opened up. We heard more sounds, but you could hear that she was actually moving air better. And so she responded well to the albuterol. We educated her that she always needs a spacer. You never outgrow a spacer. A spacer allows the medication to be delivered into the lungs instead of in the back of the throat or the mouth. It actually delivers it there. So we ordered azithromycin, 250 milligram coverage. This will broaden coverage after reviewing the chest x-ray with patchy infiltrates, and since she still has persistent low-grade fever and cough. She will also complete the course of cefdinir. So she'll take it simultaneously until she's done with the cefdinir and start the azithromycin day of. I was reassured with her oxygen saturations and her lack of increased work of breathing. So azithromycin, no refill. She'll take 2 tablets on day 1 and then 1 tablet on day 2 through 5. We also prescribed albuterol sulfate with a spacer, 2 puffs every 4 hours for the next 24 hours. And then after that as needed. We also gave her a short burst of prednisone, 50 milligram, to take 1 tablet daily for 5 days. This would also help with her lungs, with the asthma that she's having a course of. When we gave her the albuterol nebulizer in the office, as previously, there was significant improvement in aeration and wheezing after albuterol treatment. And advised her to call the clinic or the emergency room if the signs and symptoms worsens, as she did before with the ER visit. She felt much better after her visit, and Mom felt comfortable taking her back home with our diagnosis.